Imagine your brain trying to send a signal to your body, but the message gets delayed, distorted, or blocked along the way. Simple actions like walking, seeing clearly, or maintaining balance can suddenly become difficult. This is what happens in a condition called multiple sclerosis, where the body's own system starts attacking the nervous system. So, what exactly is multiple sclerosis? Multiple sclerosis, or MS, is a chronic autoimmune disease that affects the central nervous system, which includes the brain and spinal cord. In this condition, the immune system mistakenly attacks a protective layer called myelin, which surrounds nerve fibers. Myelin acts like insulation around electrical wires, helping signals travel quickly and smoothly along nerves. When this protective layer is damaged, nerve signals slow down or become disrupted. This leads to problems in communication between the brain and the rest of the body. The damage caused by MS can occur in different areas of the nervous system, which is why symptoms can vary widely from person to person. Common symptoms include muscle weakness, difficulty walking, numbness or tingling, vision problems, fatigue, and issues with coordination and balance. MS often develops in episodes, known as relapses, where symptoms suddenly worsen, followed by periods of recovery called remission. Over time, the damage may accumulate, leading to more persistent symptoms. The exact cause of multiple sclerosis is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Infections, immune system abnormalities, and certain lifestyle factors may increase the risk. The understanding of MS has improved over time as scientists studied how the immune system interacts with the nervous system. This has helped identify the role of myelin damage and inflammation in the disease. Although there is currently no cure for MS, treatments are available to help manage symptoms and slow the progression of the disease. These include medications that reduce immune system activity, physical therapy to improve movement, and lifestyle strategies to maintain overall health. Modern technology is also playing a role in MS research and care. Artificial intelligence and machine learning are being used to analyze brain scans, detect early signs of the disease, and track its progression over time. These tools help doctors make more accurate diagnoses and develop personalized treatment plans. Multiple sclerosis is a complex condition that disrupts communication within the nervous system. Understanding how it works helps raise awareness and highlights the importance of early diagnosis, proper treatment, and ongoing research to improve the lives of those affected.